Welcome back to ZPTV. It's Amanda, and we are continuing with our segment called Ask a Specialist. And tying in April being Foot Health Awareness Month, we have the luxury of bringing in some specialists, and I have one very special guest today in the studio. This is Dr. Brett Helfner, one of our radiologists here at Zwanger-Pesiri. Thanks for joining me today.
Thanks for having me, Amanda.
You're very welcome. So I keep hearing around the place that we have subspecialty trained radiologists. So what is your specialty?
My specialty is called MSK radiology.
All right, what is MSK, doctor?
MSK stands for musculoskeletal radiology.
Okay.
So in addition to the basic training that a radiology has, which is about 4 or 5 years, I then trained for an extra year focusing solely on imaging of the joints and the spine.
Wow, so we're very, very thrilled to have you here at our practice. So let's talk a little bit about what would be some of the conditions of the foot and ankle that might bring a patient to Zwanger-Pesiri.
Well, we see a variety of conditions here. The most common ones would be conditions such as stress fractures, arthritis, tendon or ligament injuries, something like an Achilles tendon tear or plantar fasciitis. And another thing we commonly see is infections in diabetics, as they are prone to getting infections in their feet.
Oh, that's not good news. I don't like to hear that. So then what would be some of the imaging modalities that we use here to help diagnose some of these ailments that you described?
Well, we have 3 or 4 imaging modalities that we primarily use. The most common being X-ray, which is good for diagnosing fractures, anything wrong with the bones. Okay. We also have a more advanced imaging modality to evaluate the bones called CAT scan. Mm-hmm. And we have another imaging modality called MRI, which does not use radiation, but is good for evaluating the soft tissues as well as the bones, and that imaging exam is pretty much the gold standard for foot and ankle imaging. Okay,
but the one modality I didn't hear you mention was ultrasound, and I'm hearing a lot of word on the street about tying in ultrasound with MSK.
Good point, Amanda. We actually do quite a bit of ultrasound for musculoskeletal conditions here at Zwanger-Pesiri, including conditions of the foot and ankle. Primarily, we use them to diagnose injuries of the tendons and ligaments. We can also do ultrasound to diagnose cysts that may occur in the foot and ankle. And another condition that we commonly see is something called a neuroma, which is scarring that occurs around the nerves that run in between your toes. And that can often occur in women that wear high heels, and it can result in pain and some tingling and numbness in your toes.
Well, I can relate to some of those symptoms. So then going back to some of these exams and the modalities, what are some of the procedures that we might use here at Zwanger-Pesiri?
So we actually use ultrasound for image-guided injections. We can take the ultrasound machine, so we know exactly where we're sticking that needle, and inject steroid into an arthritic joint or around an inflamed tendon. Another injection that we perform here at Zwanger-Pesiri is injection of neuromas in the foot, which occur in between the toes, as I said before, and that often provides quite a bit of relief.
Okay, so some of the tips that you could impart with our audience to help maybe alleviate some of these symptoms that you come across daily.
Well, as always, with any muscle in the body, it's important to stretch before you're about to engage in any rigorous activity, either athletic activity or a long run or a long walk. In addition to stretching, light massage is also helpful following any kind of rigorous activity.
I'm down for that.
There you go. And another important thing for foot and ankle care, especially if you're diabetic, is to have good toenail care and to have the bottom of your feet checked regularly by your podiatrist or other doctor to make sure that you don't have any ulcers or infections brewing. Diabetics are prone to these because they have neuropathy and sometimes don't feel an ulcer infection at the bottom of their foot. And if it goes undiagnosed long enough, that infection can spread to the bone.
Oh, that's some great information. So again, if you're experiencing any of these symptoms that Dr. Helfner may have pointed out, make sure that you're consulting with your primary care physician or your podiatrist to see which test is right for you. We look forward to seeing you at Zwanger-Pesiri. Dr. Helfner, thank you for your time today.
Thanks for having me, Amanda.
My pleasure. Stay tuned for this next exciting clip. Always good to have you. We'll talk to you soon.